Right.
But I want to talk about erectile dysfunction. My God, it's an epidemic that we're seeing. I know, those companies now that does the online platform
Right.
and send you Viagra. I won't
Yeah.
say the name here.
Yeah.
But what the average age of patient receiving Viagra from those online platforms, I think we discussed this. So what was
20s.
the average age?
Wait, they'll send you Viagra and finasteride.
Yes.
Both in the same package.
Yes, probably around 30 to 35, right? I mean,
35.
it's anonymous. Patients can get it from the comfort of their home. It's done both good and bad.
Yes.
The one good it has done is it has broken the myth of, oh my gosh, I have ED,
Right.
and so therefore patients are able to access it easily. They don't have to oh my gosh, go sit in a doctor's office, think about this medicine all the time, and then able to get it. But the bad is they're not getting an evaluation.
Yeah.
They could have an underlying problem,
Right.
and now they're getting it at a very young age, and we just don't know the long-term impact of what this.
And they're
is going
using
to
it without
happen.
strategy. I mean, they're just
Correct.
taking it like, Skittles. So
Right.